The top stories tonight in Y News. The Philippines has recorded more than 10,000 new COVID-19 cases today, setting a new record high.
The DILG urges all local government units in areas under enhanced community quarantine to provide assistance to their constituents.
The first batch of COVID-19 vaccine bought by the government has arrived in the country.
And a massive blaze breaks out at an oil refinery in Indonesia. Good evening, Philippines and the world. We are now reporting live from Welcome Rotonda in Quezon City. Today is Monday, March 29, 2021. I am Jorlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website untvweb.com. I am William Theo.
First in the news. President Rodrigo Duterte will have his regular talk to the people tonight to decide the quarantine classification that will be implemented next month. Meanwhile, the president will also discuss the financial aid for those affected by the implementation of a one-week enhanced community quarantine in Metro Manila, Rizal, Laguna, Bulacan, Cavite, and Cavite. Rosalie Cos will tell us why.
President Rodrigo Duterte will meet with top officials of the Interagency Task Force in Malacanang tonight. He is expected to announce the community quarantine classification for April 5 to 30.
Inaasahan po natin na sa Talk to the People, masasapinal na yung quarantine classification simula April 5 hanggang katapusan ng Abril.
Some experts are recommending to the IATF to extend for 2 weeks the enhanced community quarantine over Metro Manila and the provinces of Laguna, Cavite, Rizal, and Bulacan, or the so-called NCR Plus bubble. This is to continuously slow down the COVID-19 cases in the country. However, Presidential spokesperson Harry Roque said that the government is considering carefully before deciding. He added the total health condition of the public must be considered not only on the issue of COVID-19 but other health factors as well as hunger, which may worsen if ECQ is extended.
Binabalanse po natin ngayon yan, kinukonsidera natin yung total health na ating mga kababayan. Napakaselan po talaga. Dahil kung ang susundin lang natin ay yung isang aspekto na dapat pababain ang numero ng COVID-19, baka naman po mas maraming mamatay dahil po sa pagkagutom. At titignan din po natin, siyempre, yung kakayahan na magbigay pa ng malawakang assistance.
Meanwhile, according to Budget Secretary Wendell Avisado, based on the data of the Department of Social Welfare and Development and the National Economic Development Authority, around 22.9 million low-income households are affected by the ECQ reimposition. They are the target beneficiaries of the social amelioration assistance of the government. Around 23 billion pesos in unutilized government funds could be tapped to bankroll the assistance program. However, the DBM declined to comment on the amount of assistance because the issue is pending before the office of the president.
Truth is, meron talaga tayong natitira pang unutilized amounting to 23 billion, no? And how fortunate are we that based on the data provided to us by NEDA, the ones that are going to benefit from this financial assistance would be about 22.9 million targeted beneficiaries.
The DBM is not sure if the amount of funds mentioned is enough to assist those who will lose their jobs if the ECQ will be extended for 1 month. The president is also expected to decide on the matter tonight as well as how the assistance will be distributed. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health recorded another record high in the number of COVID-19 cases today. This after the DOH reported 10,016 new cases, bringing the total COVID-19 cases nationwide to 731,894. The previous record high was 9,838 on March 26. Based on the DOH case bulletin, there were also 78 new recoveries and 16 new deaths. This brought the total number of recoveries to 603,213 and total deaths to 13,186. Of the 115,495 active cases, 95.9% were mild, 2.4% were asymptomatic, 0.7% were critical, 0.7% were severe, and 0.41% were moderate. The DOH said 3 labs were not able to submit their data to the COVID-19 document repository system on March 28, 2021.
Meanwhile, the Department of Health, or DOH, has projected that the number of active COVID-19 cases in the country may hit to more than 400,000 if enhanced community quarantine in the NCR Plus bubble will not be enforced. Aiko Miguel will tell us why.
The Department of Health says the intensive care unit utilization rate in the National Capital Region Plus bubble is worrisome, as it has reached 70 to 100%. According to Department of Health Undersecretary Maria Rosario Vergere, ICU beds are now fully occupied of COVID-19 patients. It also appears on the projection of DOST Faster that COVID-19 cases may continue to rise in the country if stricter quarantine measure will not be implemented. Faster is an instrument that can be used to forecast future number of infections, confirmed positive cases, deaths, and recoveries.
Projections from Pasteur showing that if we reduce the transmission and the reduction of transmission is low, meaning we are not going to impose harder lockdowns or harder measures, 430,000 active cases nationally. We will have that by the end of April. And that will compare to our 105,000 active cases ngayon. 350,000 cases in NCR alone by the end of April.
Undersecretary Vergere adds in a week's time they expect that COVID-19 transmission of variants be reduced. There will also be fewer cases of hospitalization among Filipinos, and the healthcare system may recover.
Nakikita po natin na nahihirapan yung sistema natin. We are choking. We are having full capacities in ERs, in ICUs. So gusto ho nating ma-manage ng maayos to. Hindi natin sinasara ang ating pinto, no? This is not cast in stone. Basta ang usapan muna ng higher officials natin, tignan muna natin itong isang linggo na ito. Napaka-critical ng linggong ito, unang-una because of the Holy Week, and we know that there are a lot of religious activities being done during this week. Pangalawa, maraming din po sa ating mga kababayan ang gustong nagbabakasyon kapag ganitong panahon.
The DOH also says it is also possible that ECQ in the country may be extended, but will also depend on its impact on the country's healthcare system capacity.
Yun naman ang napag-agrihan. Meron po tayong gagawing weekly targets for our local governments and of course for the national indicators para makita natin at maging basihan para sa desisyon kung tayo ay magtutuloy pa ng another week o tayo ay magli-lift na. So everything will be flexible, everything will be dynamic, it will be based on a lot of factors, but most importantly, it will be based on the capacity of our health system. Pag nakita na natin na nakakahinga na ang ating mga ospital, pag nakita natin na umaayos na at kaya na ng ating mga ospital, magdidesisyon po tayo.
Aside from the overwhelming of hospitals in NCR because of hospitalization, many healthcare workers have been infected with COVID-19. Based on the DOH's report last March 27, 15,771 healthcare workers have been infected. 82 have succumbed to COVID-19. With this, they are lacking manpower in hospitals. Part of the country's augmentation force in hospitals is to send military men to help healthcare workers.
Ang isa sa rekomendasyon ay yung ating mga military reservists. So Secretary Galvez and Secretary Lorenzana has already committed na yung military reservists are already being mobilized para mabigyan natin ng augmentation for health human resources ang ating mga ospital.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Police personnel were reminded to be flexible in implementing the quarantine protocols in areas under the enhanced community quarantine. Leah Ilagan explains why.
The Philippine National Police declared the first day of the implementation of enhanced community quarantine in Greater Metro Manila area as peaceful and orderly. Joint Task Force Coronavirus Shield Commander and Deputy Chief for Operations Police Lieutenant General Cesar Hawthorne Binag says motorists are following the health protocols like wearing a face mask and face shield.
Natutuwa ako, nakita ko rin yung volume ng sasakyan kanina pagpunta ko rito at mag-iikot pa kami. Talagang sumusunod sila. Sana tuloy-tuloy na to para mas mapabilis yung ating pag-recover dito sa crisis na to.
Binag stressed that they will be flexible in the enforcement of protocols primarily aimed at slowing down the spread of the COVID-19.
Ipatupad natin ang ECQ pero unawain din natin na kailangan natin ng essential workers, kailangan natin ng maggagawa sa butika, yung magdi-deliver ng pagkain. No? Basta lang meron silang pruweba, may pakita nila na talaga ay sila nga ay ganun kasama doon sa mga essential workers saka doon sa APOR na sinasabi natin.
Like the driver of this public utility vehicle who was caught violating the 50% capacity of passengers implemented by IATF. But the Joint Task Force Civil Shield Commander let them pass through the checkpoint as some of the passengers are essential workers.
Unang-una, nakita naman natin may harang yung bawat pasahero, di ba? Pero sobra pa rin yung kanilang capacity. Kaya lang nga dahil hindi agad-agaran na nakita ng mga driver. So sa ngayon ang inutos ko para naman hindi sila maabala, nakita nyo naman essential worker yun. Yung isa sa supermarket nagtatrabaho, yung isa naman sa butika, yung isa papasok. So kailangan sila para tumakbo yung ating buhay.
Other drivers who will be caught violating the protocols will be issued a ticket.
Meron dyan na silang fine na tinatawag, pwede silang issue ng ticket, no? Overloading o kung ano man yung appropriate doon.
The PNP has deployed a total of 9,356 police personnel in 1,112 checkpoint areas in National Capital Region plus Bubble. At the checkpoint, motorists must present an identification card or employment certificate to prove that they are essential workers. Binag also reminded the non-essential workers should stay at home. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
Low-income earning families are now seeking the government's assistance after the reimposition of the enhanced community quarantine in the National Capital Region plus Bubble. The Department of Interior and Local Government or DILG meanwhile is urging the local government units to step up and help their constituents. Janice Ingente explains why.
Mayan Reyes, a garbage collector, is complaining after the government placed Metro Manila under ECQ for 1 week. Before the lockdown, she was earning 300 pesos a day, but now it has decreased to 100 per day because of the quarantine restrictions.
Lalo na sa pagkain ngayon, sa trabaho, mahirap. Mahirap kumita ng pera. Paano na lang kami kung ilalockdown pa kami dito? Ano pa kakainin namin? Hindi na po yung hakot namin ng basura. May oras na lang kami kasi nagitwit lalo sila.
Reyes hopes that the government will give them an assistance to cope up with their daily needs. Aside from Reyes, Marites San Andres, a vendor, is also having difficulty in making money now that few customers buy her goods. Like Mayan, Marites is also the breadwinner of their family after their husbands lost their jobs due to the pandemic.
Napakatumal ng paninda namin, walang taong lumalabas ng bahay. Sana matulungan kami dahil ganito lang yung hanap buhay namin. Asawa ko mekaniko kaso walang trabaho ngayon. Gawa ng ganito nga nangyari, walang trabaho.
According to Department of Interior and Local Government or DILG Undersecretary Jonathan Malaya, local government units should be providing the assistance to their constituents.
We are encouraging all local government units na magbigay po ng tulong or ayuda sa iba't ibang sa kanilang mga sakupan sa kanilang mga constituents.
Malaya says there are mayors who have prepared to give donations for affected residents in their area.
Inihahanda na po ng mga LGUs, especially po dito sa NCR plus bubble area, yung kanilang mga ayuda. Iba-iba pong klase, no? Meron iba ang ibibigay bigas, yung iba naman po ay cash, yung iba naman po ay gulay, yung iba naman po ay relief goods, iba-iba po yan. So, ito pong tulong na manggagaling sa mga local government units, ito po ay in addition pa or augmentation doon naman sa na ibibigay ng national government.
The help from LGUs is separate from augmentation that the national government will give to ECQ affected residents. Janice Enhente, UNTV, News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. The 1 million CoronaVac vaccines, the first batch out of the 25 million doses procured by the government from the Chinese firm Sinovac, has arrived in the country this late afternoon. President Rodrigo Duterte, Health Secretary Francisco Duque III, Vaccine Czar Secretary Carlito Galvez, Senator Christopher Lawrence Bongo, and Chinese Ambassador to the Philippines Wang Xilian received the vaccine doses at the Villamor Air Base in Pasay City. The remaining 24 million doses are scheduled to arrive in the following months. According to Malacanang, these vaccines will be used to inoculate health workers or the group A1 in the vaccine priority list, as well as A3 or those with health conditions or comorbidities. Majority of the vaccines will also be distributed to COVID hotspots in the country.
Pero ang bulto po niyan dito pa rin sa NCR Plus, Cebu at Davao. At ito po ay gagamitin sa health professionals at saka doon po sa comorbidities.
Meanwhile, the government is planning to ramp up the vaccination by holding a simultaneous inoculation of health workers, senior citizens, and other priority groups due to the increase in COVID cases. Aiko Miguel details this report.
The Department of Health gave a go signal last Saturday to local government units to start inoculating the A.2 or senior citizens sector and A.3 or those with comorbidity. According to DOH spokesperson Undersecretary Maria Rosario Vergere, this is to give more protection to those who belong to the vulnerable sector. The government plans to conduct a simultaneous vaccination of the priority groups.
Hindi na natin naantayin, makumpleto pa natin lahat ng healthcare workers na hirap na pong maghanap yung ating mga implementing units. Dahil may nag-aantay na rin po ng mga vulnerable na kailangan na rin natin bakunahan. Ang isa sa key or turnkeys dito po sa ating gustong ma-achieve na mabawasan ng mga nauospital at mabawasan ng mga namamatay is the speed of vaccinating individuals.
Based on the presented report of Dr. John Wong, member of the IATF data analytics expert, people with comorbidities like hypertension, cardiovascular disease, malignancy, diabetes, obesity, and chronic kidney disease are eligible to receive the COVID-19 vaccines. Dr. Wong adds it is important to inoculate senior citizens to protect them from having severe COVID-19 infection.
The elderly are 15% less likely to be infected. And this is probably because they have been asked to quarantine or to shelter in place during our lockdown last year. However, if they get infected, they're 5 times more likely to get severe disease and 10 times more likely to die. That's why it's very important to vaccinate them as soon as possible to prevent these hospitalizations and deaths.
AstraZeneca COVID-19 vaccines can be given to senior citizens, while the CoronaVac of Sinovac can be given to those with comorbidity. The DOH is requesting everyone to follow the prioritization framework set by the World Health Organization and Gavi of the COVAX facility, so succeeding vaccine supply will not be compromised and the country will not have to pay for breaching it.
Huwag na natin paabutin doon. Sumunod na lang po tayo doon sa ating framework for prioritization, which is part of the conditions when we were accepted into the Gavi facility or the COVAX facility. Let us try to align and to comply with the prioritization framework.
The DOH calls on senior citizens to register in their respective LGUs in NCR until March 31, while registration is open in other regions until April 5. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Navotas City local government has started vaccinating its senior citizens against COVID-19, starting with the oldest among its population. Pelayo explains why.
Hundreds of senior citizens flocked to the San Jose Academy covered court in Navotas City to avail of the vaccination program. Most of them are more than 8 years old. Juanita Guanzon, 83 years old, received her jabs today after never leaving her home for more than a year when pandemic started.
Dadalawin ko yung apo ko sa Australia. Hindi totoo, ano lang, joke. Hindi ko na kaya bumiyahe.
Eliseo Villanueva, 81 years old, was convinced to be vaccinated to protect himself and his relatives.
Baka mamaya, mahawa ka, makakahawa ka naman. Dapat tayong mabakuna para hindi ka makakadami pa ng ibang tao.
200 doses from the first batch of AstraZeneca COVID-19 vaccines were allotted for the senior citizens. Navotas City Health Officer Dr. Krisha Padolina said only 3,000 out of the 30,000 senior citizens in Navotas City registered for vaccination. The official also notes that 90% of the 1,200 health workers in the city were already vaccinated.
Nandun na tayo sa A2. Okay, so priority after frontliners, nandun na tayo sa senior citizen. Pagkatapos nito ay ang ating mga 59 years old below pero may comorbidities. Ito yung may mga sakit na gaya ng halimbawa hinihemodialysis o kaya may hypertension.
Mayor Toby Tiangco hopes that with the rollout of vaccination for senior citizen, more of them will be encouraged.
Iba yung salita, iba yung nakikita talaga nila na 200 walang naging adverse effect. So it will build confidence.
Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
After strongly warning against the use of Ivermectin to treat symptoms of COVID-19, the Philippine Food and Drug Administration says doctors who want to use the drug against COVID-19 may apply for a compassionate special permit. Joan Nano tells us why.
As supplies of investigational drugs remdesivir and tocilizumab that are being used to treat COVID-19 patients are depleting due to surge of COVID-19 patients. Several groups are urging the Food and Drug Administration to allow the use of the antiparasitic drug Ivermectin, which according to some studies can treat symptoms of COVID-19. However, the FDA earlier warns that as of now, Ivermectin in the Philippines is only registered for veterinary use to treat parasites in certain animal species. For humans, the drug is currently registered as a prescription drug in topical formulation for the treatment of external parasites. But in today's Laging Handa PH public briefing, FDA Director General Undersecretary Eric Domingo explains that hospitals and doctors who want to use Ivermectin to treat symptoms of COVID-19 in patients may apply for a compassionate special permit.
Tinanong po ako ni Secretary Duque last week kung pwede ba ang CSP for Ivermectin. Sabi ko pwede kasi investigational drug naman talaga ito for COVID-19. So kung gusto po ng kahit sino naman na doktor o ospital na gumamit ng isang gamot under compassionate special permit, then they have to apply po sa FDA at kailangan lang po syempre kompleto yung ating requirements at of course, they take full responsibility for the product.
Yusek Domingo further pointed out that Ivermectin can be prescribed as a drug for humans, however, there is no existing application yet. He adds that wrong medication may cause harm to humans.
Well, ang Ivermectin po, ano naman siya, no? Ito'y gamot din naman talaga sa tao. Wala na lang nagre-rehistro dito sa Pilipinas for the past 3 years. So medyo safe naman siya. Pag mataas na dose, yun lang ang nagkakaroon ng mga encephalopathy, nagkakaroon ng mga epekto sa utak, pero at very high doses. Kaya lang po kasi, sinasabi lang natin, hindi pa naman proven talaga kung ito ay nakakatulong sa COVID-19.
The House Committee on Health, chaired by Quezon 4th District Representative Angelina Tan, is set to conduct a probe tomorrow to investigate the questionable use of Ivermectin as a treatment for symptoms of COVID-19. FDA assures that they are willing to face the investigation and will grab the opportunity to explain the process of regulating these drugs. Meanwhile, the FDA assures that restocks of remdesivir will be delivered on hospitals within this week. However, supplies will still be limited.
Just this morning po, yung mga companies na nag-import ng remdesivir for our hospitals nagbigay sa amin ng report, and most of them have stocks on hand. So makakapag-deliver naman daw po sila this week. Talaga naman po dinidistribute lang nila ng hindi maramihan sa lahat ng ospital para lahat unti-unti po magamit ito sa mga nangangailangan.
Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
As the enhanced community quarantine takes effect in Metro Manila and 4 neighboring provinces, the city government of Marikina will not penalize those who will be caught violating the curfew hours. According to Marikina Mayor Marcy Teodoro, he instructed the city police and village chiefs to be compassionate to quarantine violators.
Ang curfew, sabi ko kung pwede ay magpaalala lang tayo. Wala munang penalty o punishment na mabigat dahil mahirap ang buhay. Maraming tao ngayon ang nakakaranas ng pagkagutom, maraming kababayan tayong walang trabaho.
Teodoro adds the city government will no longer issue quarantine passes as the ECQ is expected to last only for a week. He also called on the Mariqueños not to panic buy as he assures that all essential stores will be open. In the Marikina City Public Market, no market schedule was imposed to facilitate the unimpeded flow of goods and residents buying essential goods. Despite the rising COVID-19 cases, some vendors and customers say they chose to brave the threat for their livelihood.
Mahirap, nandun yung pangamba. Kaso, hindi naman po pwedeng mananahimik na lang tayo sa bahay kasi ang hirap ng buhay. Kaya kahit na ganito kahirap yung sitwasyon, kailangan pa rin ituloy yung hanap buhay kasi wala naman tayo ibang maaasahan. Para sa inyo? Mahirap po. Kasi yung kita pong konti lang sa araw-araw din po namin kinukuha yung panggas. At wala kaming pangbahay ng bahay. Bahala na.
However, in terms of aid to most affected families, the city government is still waiting for the financial assistance as promised by the national government. Despite this, Teodoro assures that they are ready to distribute food packs to the families in dire need of assistance. Meanwhile, Pasig City Mayor Vico Soto says they will also wait for the emergency subsidy from the government as they can only do so much.
We'll do what we can, So, hindi tayo nangako na kung ano, pero yung mga food packs o yung assistance, nagbibigay naman po tayo consistently, lalo na sa mga naka-quarantine, yung mga naka-isolate. Pero kung yung para sa lahat ulit, katulad nung unang ECQ, ay aminin ko baka hindi po namin kayanin sa ngayon.
Mayor Soto adds most of the establishments in the city are compliant with the ECQ rules. For now, the city is focusing on increasing its healthcare system capacity due to the increase of COVID-19 cases. As of Sunday, Pasig City has over 14,000 confirmed cases with more than 1,800 active cases and 12,000 recoveries. Public transportation was made available in NCR Plus during ECQ, but commuters still experience difficulties in hailing their rides. Asher Gadapan Jr. explains why.
Aside from only allowing authorized persons outside residence or APOR and essential travels to move within NCR Plus while it is placed under enhanced community quarantine, there is a decrease in the capacity in all public transportations. This include all rail lines in Metro Manila where passenger capacity has decreased to 20 to 30%. All public utility vehicles including public bus, jeep, UV Express, shuttle service, tricycle, taxi, and TNVS are now limited to only 50%, observing 1 seat apart rule even with plastic barrier. With this, some public commuters are challenged in going to their work.
Pag umaga kasi mahirap sumakay, siksikan din pag nagagawan sa bus.
Heavy traffic were also experienced in quarantine control points or checkpoints where authorities inspect every motorist to make sure they are authorized to travel.
Okay lang naman ang biyahe. Yun nga lang, may mga part na may checkpoint. So, ECQ, normal naman siguro checkpoint. So, may pinakita naman kami dokumento. So, wala naman naging problema.
Meanwhile, provincial buses are still allowed provided it is a point-to-point route. Domestic commercial flights are still operating but only allows passengers depending on the restrictions implemented by the receiving LGUs. NCR Bubble, on the other hand, strictly allows APOR as inbound domestic passengers, while international inbound passengers capacity in NAIA remains at 1,500 per day. Maritime transport for public passengers are also limited to 50% capacity. These guidelines will be stringently implemented by personnel of the Department of Transportation in the 4 transport sectors.
Ang mga enforcers po natin, ang mga transportation marshals, although masipag po yan na nagbabantay sa ating mga pantalan, sa ating mga airports, sa ating mga road and railway stations, hindi naman po yan nila kayang bantayan ng lahat ng sulok at 24/7, kaya kinakailangan po yung kooperasyon ng ating mga kababayan.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Good evening. For the news abroad, a massive blaze at an Indonesian oil refinery has prompted the evacuation of about 1,000 local residents that live nearby. Marvy Delphine will give us the details live. Yes, Marvy?
LC State Oil Company Pertamina has ceased its operations at the Balongan refinery in West Java as firefighters worked to extinguish a massive fire that broke out overnight. The fire was concentrated in the refinery's storage units, and there had been no known impact on the plant that processes 125,000 barrels per day. According to company spokesman Ifki Sukaria, no staff were hurt, but 5 people are currently being treated in hospital for burns, while 15 others were slightly injured. 1 person had reportedly died from a heart attack after the explosion at the facility. The cause of the fire was still unknown, although the blaze started during heavy rain and a lightning storm. Pertamina said it was conducting oil flow control to prevent any further spread of the raging inferno. West Java Police, on the other hand, will be involved in the investigation. The executive director of think tank Energy Watch, Mamit Setyawan, believes that Pertamina's Silicap refinery in central Java should be able to meet any supply shortage in the short term, but repairs could take months depending on the damage. Though Pertamina's chief executive Nike Widyawati hopes that operations will be restored in 45 days as the fire had been contained to a small area. Elsie?
All right, Marvy, thank you for that live report. A suicide attack took place outside a Catholic church in Indonesia, leaving at least 20 people wounded. Maybe Dog will give us the details live. Yes, Maeve?
LC, the explosives were detonated outside a church on the island of Sulawesi in Makassar, Indonesia, with at least 20 people left wounded and the 2 suicide bombers being the only casualties. Surveillance camera footage showed the explosion, which occurred around 10:30 a.m., blowing flame, smoke, and debris into the road. The attack happened just as the Mass was ending on Sunday, with the priest who was leading the Mass stating that the church's security guard suspected two motorists who wanted to enter the church. According to National Police Chief General Licio Sigit Prabowo, the attackers are believed to have been members of Jamaah Ansharut Daulah, an armed group that has pledged allegiance to ISIS. The group was also responsible for the suicide bombings on Indonesian churches in 2018. President Joko Widodo stated in an online broadcast that he has ordered the police chief to thoroughly investigate the attackers' networks and to tear down the networks to their roots. Following the deadliest attack in Indonesia, which took place in Bali in 2002 and killed 202 people, Indonesian security forces have had some major successes in stopping attacks by armed groups. With the recent resurgence of violent attacks, officials are urging the public to remain calm and trust the authorities. Elsie?
Thank you, Megan Dog, reporting live from Queensland, Australia. The world's busiest shipping lanes will soon be reopened for traffic. Nina Bascon reports why.
After many attempts and great efforts, the evergreen container ship blocking Egypt's Suez Canal for nearly a week has been partially refloated. The partial freeing of the vessel came after intensive efforts of 10 tugboats when the full moon brought spring tide. On Tuesday last week, the cargo ship got stuck sideways of the canal, halting shipping traffic on the shortest shipping route between Europe and Asia. After many attempts and tries, it was decided yesterday that the canal officials will start to remove roughly 20,000 containers on board the ship to lighten the cargo. Egypt's Suez Canal is known as one of the busiest trade routes, and as a result, more than 300 vessels waited at both ends. This caused many delays, particularly in the delivery of oil and other products. Due to the delays, shipping companies were forced to take far-long routes around Africa, which takes up to an additional 12 days. It was stated that the blockage was holding up to an estimation of $9.6 billion worth of cargo each day in global trade and straining supply chains already burdened by the coronavirus pandemic. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
Mexico's government has published revised figures indicating that the number of deaths caused by coronavirus is 60% higher than previously reported. This report explains why. Mexico's new health ministry report suggests that a total of more than 321,000 people have likely died from COVID-19 since the start of the pandemic. The revised toll places Mexico with the second highest number of COVID-related deaths in the world after the United States. The revised report showed that by the end of the 6th week of 2021, there had been 294,287 deaths associated with COVID-19, up from the 182,301 confirmed figure given previously. President Andres Manuel Lopez Obrador has faced widespread criticism over his handling of the crisis. The opposition blamed him for delays in the vaccination program and has accused him of downplaying the severity of the pandemic and is often seen in public not wearing face masks. Experts have long warned that Mexico's true death toll is probably much higher due to a lack of testing. It is also believed that a shortage of intensive care beds in many states has led to a large number of people dying at home. The new figures came after a review of excess deaths and review of death certificates. Last week, Hugo Lopez-Gatell, who is heading Mexico's response to the pandemic, warned that the country risks a new wave of infections as millions prepared for the holidays. Elsie Marcos, UNTV News and Rescue, New Zealand. We serve the people, we give glory to God. Thousands of music fans were able to sing and dance along at a concert on Saturday at Barcelona, Spain. While the rest of the country is limited to gathering of no more than 4 people in closed spaces. Oliviones reports why.
5,000 people packed at a sold-out concert of Spanish indie band Love of Lesbian, held at Palau Sant Jordi in Barcelona on Saturday night after testing negative to coronavirus. This live event is a trial to revive the music industry of Spain. The government and health authorities have approved the concert, and it serves as a test of the strategy's effectivity. The scheme implemented required ticket buyers to take antigen tests at one of the 3 venues on the day of the concert. Results were then sent via mobile phone notifications, and only those who receive a negative COVID-19 results will be allowed to attend the concert. Those who had positive results were refunded. According to Dr. Boris Revolio Barriga, a virologist involved in the design of the health protocols, this is another step towards bringing back cultural events. According to Jordi Herreruela, a co-organizer of the concert and promoter of the initiative, this is first in the history and the largest held in Europe since the start of the COVID-19 pandemic. He added that it is safe to be in the concert without the social distancing because the attendees are all negative to coronavirus. Early Briones, UNTV News and Rescue, we serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
This just in, Presidential Communications Operations Office Secretary Martin Andonar confirmed he has contracted COVID-19. The Secretary said he was found positive of the virus after he underwent swab testing at the airport upon his arrival in Metro Manila from the Dinagat Islands. The official reiterated he tested negative before going to the province. The official is asymptomatic and now under home quarantine. Law enforcement authorities are appealing to the public to be more patient when passing through checkpoints. Marvin Calas reports why live. Marvin?
Suspected passing vehicles in the border checkpoint at San Mateo Batasan Road that caused a long and sluggish traffic flow around 7 to 9 a.m. this morning. It then prompted QCPD appealing the public to stay home, especially if not essential, in aid to reduce the growing cavalcade of vehicles. Valid identification cards and a certificate of employment were asked to identify commuters as authorized person outside residence or APOR. Those who cannot present such identification documents are not allowed to enter. Meanwhile, significant or insignificant fewer market goers are observed as the team rounded marketplaces in Quezon City this morning. A limit of 300 to 400 individuals are set to enter the Balintawak public market. A tighter health protocol was also implemented.
Pinatupad nga yung ano na yan, yung sa ECQ na yan, kaya nabawasan yung mga namimili. Record kasi na wholesale kasi dito sa amin. Kaya lahat po ng namin, ini-inspect namin bago sila pumasok dito. Kailangan may quarantine pass pa rin, naka-face mask, naka-face shield. Importante kasi yan, sir.
Single entry yung market. Bali, ang pasukan po ng namimili doon sa dulo sa may riverside area. Tapos ang exit naman nila dito sa may Jollibee banda to prevent yung congestion ng tao at makita natin yung mga namamalengke kung proper yung suot nila ng face mask at saka face shield.
Are not allowed to enter as well as senior citizens. The latter are expected or they are exempted given that they have no companion and in need to access essential goods. A significantly lower income were also observed by market vendors but indeed understood why the government needs to implement such restrictions in aid to lowering COVID-19 cases.
Mababa ang bentahan ngayon. Kumpara nung kahapon, malaki ang bentahan kahapon kaysa ngayon. Mas maganda yung ganito kasi nadidisiplina yung mga tao. Hindi katulad yung dati na tulad ng dati nakababa yung face mask. Tapos hindi katulad ng ganito na maganda na silang disiplina talaga ang nila.
Napakatumal. Sa sobrang higpit. Kaya walang ganong tao na namimili. Tumal, minsan nakakaraos din kahit paano sa hirap ng buhay.
Konti lang ang tao tapos ang hirap pumasok dito.
Kasi iikot pa mula sa sa pasukan. Mas maganda ngayon kasi sinisita nila bawat tao.
Individuals caught violating the minimum public health standards are fined and are issued corresponding ticket by the Task Force Disciplina. That's our latest live. Back to you, Diego.
Thank you for that report.
And those are the reasons behind the news, March 29, 2021. I am Jorlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people, we give glory to God.